Today we're going to be presenting information about panic attacks, which are also known as anxiety attacks. They can be described as a sudden unexpected surge of overwhelming anxiety lasting anywhere from 5 to 30 minutes. The exact cause of these attacks are unknown, but there are studies indicating genetic, environmental, and biological factors. Most common risk factors or stressors include major life transitions, severe stress, and some medical conditions. Today we will show you how a panic disorder can affect someone in everyday life.
Okay.
Hi, how are you today?
Good.
Good. My name is Terry and I'm going to be your nurse today. And today I have Lauren with me.
Hi.
She's a student nurse in Nevada State College that's going to help us, okay?
Okay.
So what brought you into the ER today?
Well, we were at the Angels game, watching the game, cheering them on, and all of a sudden Annabelle had physical symptoms that scared me. She was describing them as though she was dying or going crazy, so I was like, I need to bring you to the emergency room and see what's going on. She was like profusely sweating, and she was hyperventilating. I had to take her away from the crowd and get her some water and get her to relax. So I wasn't sure if it was like a certain underlying medical condition or not.
All right, Annabelle, just relax, okay? We're going to take care of you today.
Okay.
And Lauren's going to go ahead and start with a quick assessment, and then I'm just going to hook you up to a couple machines here and just check your blood pressure and your vitals and stuff, okay?
Okay.
All right.
Okay, and with the assessment, I'm just going to start by listening to your heart and lungs and go from there, okay?
And then I'm just going to stick this on your finger. It's going to measure your oxygen and your heart rate, okay?
Okay.
And I just need you to remain calm and just let it relax.
Okay. Okay, deep breath. Good. Another deep breath.
Oh my gosh, she's profusely sweating again.
Oh my God, her heart rate is really high.
Wait,
Oh,
okay.
All right, I'm going to go ahead and call the doctor. I'll be right back.
Hold my hand.
Okay.
So,
Ring.
I'm going to go turn off the light.
Ring.
Hello?
Hi, is this Dr.
Hi,
Kwan?
close your eyes.
Yes, this is Dr. Kwan.
Hi, Dr. Kwan. I have a patient here
It's
in
happening
the
again.
with me.
Try to
She
close your
came
eyes.
in with symptoms such as sweating,
Okay.
heart
Just
rate,
imagine that you're
and other things.
Out of
And then
place.
her vitals were really high. She had a heart rate of
Maybe we should put some
162.
music on that can
I think we
relax
should
her.
recommend some
Yeah, if you have your
anti-anxiety
phone on you,
medication
you
for
can.
her.
Put some
Okay,
music on.
alright, go ahead and go give her
Take a deep
Xanax
breath.
at 0.5 milligrams.
Through your nose and out through your
And
mouth.
I'll be in a
There you
little bit
go.
to go and see her, okay?
Sounds great, thank you. Alright, so just real quick, the doctor went ahead and wanted us to give you an anxiety medication to help with this, with what's going on right now, okay? So I'm gonna have Lauren stay right here with you and I'm gonna grab the medication and then we'll get it administered to her. And the doctor said she'll be right down to check on you, okay?
Okay.
Alright.
Okay.
Go ahead and close your eyes. Okay, deep breaths. In through your nose, out through your mouth.
I'm feeling a little better.
A little better.
Mm-hmm.
Is that what she thinks it is? It's just an anxiety attack?
Yeah, it seems like it's symptoms of an anxiety attack since she's sweating, her heart rate's really high.
And how were
Really
her
panicky.
labs?
The doctor's going to come in and talk about her labs with her in a second.
A little better. A little, but it's really terrifying.
Hi Annabelle, I'm back. I got that medication the doctor ordered for you, okay?
Okay.
So I thought it would be okay as Lauren, can she administer this for you?
Yeah.
Alright,
So what am I receiving again?
she's gonna explain all that to you.
Okay.
So this is your Xanax. It's an anti-anxiety medication, so it's gonna help you calm down a little bit.
Okay.
Okay. So do you have water?
Yes, I do.
Yes. Okay. So
Okay, perfect. Alright, so I'm gonna have Lauren just sit for you with you a minute and then I'm gonna go check and see how long your doctor will be in, okay?
Okay.
Okay.
okay. So just kind of while we're waiting, so we can kind of while your medication's starting to kick in, we're gonna talk about some stuff we can do.
Alright, Annabelle, I have Dr. Kwan here to see you really quick. She's just gonna review what's going on and then we can get ready to discharge you pretty soon, okay?
Okay.
Hi, is it Annabelle? Hi, how are you feeling this morning? I heard you're having a panic attack, is that it?
Yeah, I couldn't breathe. I was shaking. I don't know. I was kind of blanked out for a second, but I mean, I don't know exactly how to explain
Alright,
it.
well,
but
I'm gonna do a little bit of an assessment on you. just for a second here. Okay. Just want to see how you're breathing. But your panic attack has it gotten a little bit better already, or?
I guess I had two within the hour or so.
Well, your labs came back and they seem normal. Okay. And I did prescribe you some Xanax already, and you take that about 3 to 4 times daily. And then after that, you're going to be discharged soon, and then just go to your physician in about 3 days time. Okay.
But will this have any effect with, how I carry on, or it was just a one-time?
Well, there are many reasons why you have panic attacks. It could be nervous. You could be nervous. There could be some stressful events that happen in your life. So all it is just being able to manage it well. Okay. All right. So.
Thank you.
All right, thank you, Dr. Kwan.
Thank you.
So Annabelle, let's talk a little bit. What do you think? Are you having any stressors in life, or is there anything that you're really anxious about on the daily basis?
Sometimes I am kind of stressed out just from overall work and school. I realized right before it happened, it was just a lot on my mind at the game. I guess probably the effects of the whole multiple population that was there, the crowd and everything.
Okay. And do you have any coping mechanisms to deal with the stress that you're having in your daily life?
I don't. Do you have any recommendations?
How about Lauren? Do you have any recommendations?
Well, what we were doing earlier, where I kind of turned off the lights and had you close your eyes, that was kind of regulating the environment to try and reduce your sensory stimulation. So that's one way that you can try and help with your anxiety.
So Annabelle, do you know how do you normally handle your stress on a daily basis?
I don't really have good coping mechanisms whenever I handle stress. I tend to get overly stressed sometimes.
Okay, well, I'm going to have Lauren sit here and just kind of go over some different things you can do at home to kind of help with that. And in the meantime, I'm going to go ahead and print out some paperwork and all that for you, and then I'll be back in, okay?
Okay.
All right.
Thank you.
Okay, so what we were kind of starting to talk about earlier, so when I had you turn off the lights and close your eyes, that was just kind of reducing environmental stimuli to help you calm down and reduce all the outside stuff. And then another mechanism was, I don't know if you exercise at all.
I try to do it weekly.
Okay, that can also help reduce anxiety by having an emotional outlet and trying to get all those feelings out. And another way could be kind of guided imagery. I know Jessica was trying to kind of get you to that happy place, like some people like to call it, like you're on a beach or something that makes you comfortable, makes you relax. And another way could be meditation, and just kind of sitting there, turning off all the lights, and just regulating your breathing, deep breaths, in through your nose, out through your mouth. Does that sound like something that you would be good with?
Yeah, those are really good, helpful
Manageable?
tips.
Hi, Annabelle, I'm back. So it looks like the doctor has all your discharge papers, and
Okay.
she feels you're good enough now to go home and be able to manage it at home. But we're also going to refer you to a primary doctor, and we'd like you to follow up in at least 3 days, okay? So let's just kind of go over this real quick. So these are the orders here, just describing what's been going on with you, so you can kind of read that at home. Do you have a better understanding of what's going on with you now?
Yes,
So
I do.
when should she take this medication?
So it's recommended that she takes it about 3 to 4 times a day. So you can just kind of base it on how her day goes, and things like that. Okay? And then underneath here, I have the prescription for you to take to the pharmacy. And you can go to any local one, okay? And then there's just some other additional reading materials here for you. Okay? And then can I just have you go ahead and sign here real quick for me? All right, sounds good. So I will go ahead and give this packet to you. And then you can go ahead and get ready to go ahead and go home, okay?
Thank you so
And then the primary doctor's name is on there as well for you.
Thank you.
You're welcome. Have a great day, guys.
Thank you.
1.
So what we have learned today? We have learned about panic attacks, that it could happen to anyone, anywhere, and at any time. Many are unaware of its signs and symptoms, that it can easily be mistaken for a heart attack and other medical conditions. If you're experiencing panic attacks or multiple panic attacks, seek treatment immediately to prevent advancing to panic disorder.
1.
Panic attacks can easily be managed through medications such as Xanax, which is an anti-anxiety medication, and antidepressants such as Prozac. If you or a loved one are experiencing signs and symptoms of a panic attack, please go online and take a screening survey to evaluate your risk of a panic episode, or if it is necessary for you to go and seek medical help.
Wait, go.
Panic!
Okay.